The Highline is a very interesting innovation that was developed at Cleveland Clinic. A pediatric clinical nurse specialist, her name is Jane Hartman, would see children walking around and their IV tubing was dragging on the floor. Obviously, that's not a very sanitary scenario, but also there's the risk of the IV being yanked or pulled on. So she wanted to develop something that would get tubing off of the floor. And this was all developed before COVID-19. When COVID-19 hit, we made calls around the country to find out how other people were dealing with certain scenarios, especially over in New York. And we found out that people were pulling all of their IV poles and drips, medications in the intensive care unit outside of the ICU doors to decrease the PPE use. And immediately Jane came running to my office saying, "Nancy, we've got a solution. We need to figure out how to make it work for the intensive care unit." We quickly went into design mode and redesigned it so that you can have up to 8 cradles, meaning 8 different IV lines on one stem, to allow nurses to have multiple lines hanging and getting them off of the floor. It looks like a telephone pole upside down hanging from the ceiling. So these long-handled hooks are what we created to allow us to hang it off the ceiling. The reaction from critical care nurses was, "Get me more, get me these now." And we actually had a few nurses that would say to us things like, "I never want to go without using this again, even when COVID-19 is over." Because it was an innovation and because we wanted to share with the country, we developed a YouTube video and then we took the links and shared them across the country with the Society of Critical Care Medicine listserv for nurses. And we started getting a lot of responses from nurses saying, "How can I get a hold of this?" We ended up making over 30,000 cradles and 600 stems. We have a wonderful network of people that help bring this to life and help make it happen. And I would encourage nurses from every hospital around the country to think about innovation and how they could promote nurse innovation within their health systems. We find that nurses are very creative, come up with great ideas, and they need our support.